Hello and welcome to MindMend. My name is Dr. Christy O'Connor. I will be your host, and I am the creator of this program and its contents. Welcome to the 12-week lecture series on eradicating addictive behaviors. In this brief introduction, I'm going to go over my background, my qualifiers for guiding you through this program and its contents. We'll go over what the program is. We'll go over the medical and societal definition of addiction and how that differs from my definition and from this program's approach to dealing with this as an issue. We will go over what to expect during the program, and I will also briefly go over some existing paradigms for treating addiction that could be used in conjunction or instead of this program and its contents. So, like I said, my name is Christy. I have a 15-year background in healthcare. 10 of those years were spent bedside nursing and critical care. I worked for not quite a year in family medicine as a provider, and then transitioned over to addiction medicine in 2020 in Portland. I practiced in addiction medicine for a little over 2 years in Portland prior to removing myself from the medical field. In terms of personal experience, I have personally manifested almost every form of addiction that exists, I think, with the exception of opioid addiction. I have been addicted to alcohol. I have been addicted to cigarettes. I have been addicted to men. I have been addicted to amphetamines. There's a very extensive list of things that I have been addicted to throughout the course of my life. I always did manage to spread them thin enough that it was relatively easy to hide, but certainly pathological nonetheless. I did my first stint in AA from the age of 19 to 26. It was a very long 7-year stretch without drinking as a young college student. But it taught me a lot. It taught me a lot about saying no to something that I knew was killing me. It taught me a lot about not being an asshole. It taught me a lot about how other people were perceiving me and my dysfunctional behavior. And I think has severely propped me up in terms of being able to formulate an actual cure to a very serious problem. So that being said, when I stepped away from medicine, in 2022, I was at the rock bottom of my life, and I chose to walk away from my career. I chose to walk away from my partner. I chose to walk away from my family. I chose to walk away from my life. And I chose to walk away from those things because I had reached a point where I was either going to find a solution to the problem, this thing that was causing all of these addictive tendencies, or I was going to die. And I was very clear on that. And I wasn't sure which one of those outcomes would prevail. But here we are. So I didn't die. It was close, but I didn't die. And my hope is that in spending time in that space in order to fish out a solution to this problem, that I can help other people who may struggle with the current paradigms that are available also find a solution to their problem. So my intention in creating this course is to provide support and guidance and hope for people that are in a process that is extremely difficult and extremely hopeless and extremely difficult to find your way out of when you don't have any resources and you don't have any help. So what this program is. So this is a 12-week long course. It is a combination of action, examination, and understanding. There are 12 lectures, and each of them have a component of action, dissecting your behavior, understanding your behavior. So the idea is we kind of start wherever the person is at this sort of topmost layer and start digging into these deeper layers using the same approach over and over again. It's kind of like drilling until eventually you get to the core of what's causing these symptoms. And once we get to that point, I think the eradication component actually happens relatively quickly. So first, in order to understand this program, I think it's important to understand the view of addiction that's being utilized in the formation of this program. So modern medicine and a lot of treatment centers and larger society will tell you that addiction is a disease. And there are some valid arguments for that. I mean, it certainly causes diseases, various addictions ranging from, lung cancer to liver cancer to mental illness, all of these things. I mean, I think it's very easy to understand how this problem can cause a wide variety of disarray in the physical body and in the mind. However, I would argue that if you take that a step further and go a layer deeper, what you find is that addiction is actually a symptom to a greater issue. I'm going to start by comparing this to a cancer to try to make it a little easier to understand. So if someone has a cancer, at some point, that cancer is probably going to reach a size where it is going to start producing certain symptoms. Those symptoms could look like nausea, could look like cognition problems, could look like neurological deficits, could look like emotional mood dysregulation. I mean, the possibilities are endless. But the reason that these symptoms are being experienced by the person is because of the cancer. And the bigger the cancer gets, the more severe these symptoms get. Now, modern medicine is relatively good at treating symptoms. So we can cover these up or treat the symptom, if you will, for a time, right? We can take medications for nausea. We can treat insomnia. We can treat physical pain to an extent, all of these things. But if you don't treat the cause, which is the cancer, eventually the symptoms are going to come back. And probably once it reaches a certain size, they will come back with a vengeance. So if we look at addiction in a similar way, we have this wounding. We all come here with wounding. We have ancestral wounding. We have wounds that are caused by traumas that we go through throughout the course of our lives. We have wounds that are caused by belief systems that don't feel right to us that we keep trying to impose on ourselves. We have all of these things that we aren't taught how to deal with, and we don't know how to deal with. And these things cause pain. So they cause emotional pain, they can cause physical pain, they can cause severe problems in developing socially. The list is endless in terms of the kinds of problems that not dealing with these things can cause. And so we have this big ball of stuff that creates pain in us. And instead of learning how to heal this set of, I call it core wounding in ourselves, we learn how to medicate it. And so when something happens that hits one of these wounds in just the right way, it causes pain. And so what do? We seek a treatment for that pain. We seek relief from that pain. And this many times is how the cycle of addiction itself can start. So it is a symptom of this greater wounding pattern that I would say comes from patterns that we develop throughout the course of our lives, and also the wounding patterns that we inherit from our parents that they maybe didn't have the resources or the time or the ability to heal themselves. So with this understanding, with this definition, with this sort of paradigm when it comes to addiction, then what we're trying to do with this program is we're treating the symptom and the cause at the same time. The tricky thing about addiction is that if you can't get enough of a handle on the symptoms, you're never going to get to the core wounding. So what I mean by that is if you are constantly in a cycle of addiction, so if you're drinking, smoking, whatevering your existence all day, every day, you're never going to be able to gain access to what exactly the issue is. You're just going to sort of be in this layer of cloud cover that is illness promoting, that promotes confusion, that promotes mental illness, all of these things that basically rob you of your ability to deal with the real problem. So we have to deal with the symptom while simultaneously deal with the wounding pattern. So we have to lightly remove periods of use. So let me try that again. We have to slowly increase the length of time between use so that we can promote enough clarity to get to the wounding and deal with that. So what this program does is it will deal with the symptom of addiction itself. And this is not an abstinence-based program. This does not require that you abstain from your drug of choice, whatever that happens to be, depending on which layer you're in. But it does ask that you make an effort to space out the period of time between usage so that there can be enough clarity to get to what exactly is needed to heal this deeper wounding pattern. So instead of looking at the addiction as being the problem, instead of looking at the use of whatever said substance or behavior is as the problem, this program looks at the set of core wounds that causes the pain that asks us to reach for these things in a bigger way. Because the truth is, if you have a brain and nervous system that is functioning appropriately, you're not reaching for these things because there's no deficit. But if you're born into a situation or grow up in a situation that promotes deficit, or all you've ever known is deficit, and what I mean by that on a neurochemical level is deficits in serotonin, deficits in dopamine, deficits in an environment that can propagate health and happiness and well-being. If you grow up in a deficit, you're going to look for things that correct that deficit. So you're going to look at different substances, different behaviors, different people, whatever, that can help boost you out of that hole. And what happens is over time, it takes more and more of whatever it is you're reaching for to correct the deficit. But if we don't fix the problem, if we don't fix the leak in the boat, it's eventually going to sink. So this program gives a detailed set of instructions on how to approach this from a treatment management, or a symptom management standpoint, and slowly chipping away at the wounding that's causing the symptom in the first place. So, and then how to use this program. So this program is, again, it's 12 weeks long, so there's one lecture per week. So it's meant to, don't go any faster than one lecture per week. If you need to go slower than one lecture per week, if you need to give it a week and a half to 2 weeks between lectures for integration, that's okay. Just don't allow yourself to slip into stagnancy, because that is certainly a trap when dealing with things like this. So this is meant to be used weekly, and the duration of it is timed at 3 months, because this is precisely how long it takes our brains to make or break habits. Now, it can take longer for us to drop habits, especially if we hold on to things and, we sort of like drudge things up in sort of this grindy, repetitive way, which is, again, why we're attacking the core wound at the same time as the symptom. So, however, 3 months in an ideal situation is the amount of time that it takes your brain to either drop a bad habit or formulate a new one. So ideally, as we're going through the steps of this program in a weekly way, what we're trying to do is, yes, eradicate the addiction, but in a more zoomed out way from that, what we're trying to do is to help you build the skill set of dropping and adding habits however you need to, in order to be successful at dropping any behaviors that are disruptive. That includes, in addition to any chemical dependency issues, that could look like sex addiction, that could look like eating disorders, that could look like engagement in an unhealthy romantic relationship, that could look like, the possibilities are endless. So once you understand how to utilize this as a skill set, you can apply it to just about anything in your life, whether you're trying to drop a habit or add a habit. So, whether you're trying to exercise more or eat differently or whatever, this program can be utilized for that. What we're really doing is we're reprogramming the physical brain. So it takes, from the time we put a substance down, it'll take the brain at least 90 days, not only to formulate the new habit, but also to make a significant amount of headway in healing from being bombarded with whatever the substance is. So, for example, for me, I think nicotine was the hardest one because it was the one I used for the largest period of time. So I had a 20-year history of using this substance. And so that one took 3 years of this cyclic program to completely get rid of it. It will happen. It will happen. And I don't think it has to take that long. And in some instances, it didn't take that long for me. With other things, it did not take that long at all. So I think it depends on your use history, your age, how committed you are to healing and to learning new things and to growing. And there's nothing wrong with a slower pace. Although what I found after a certain point is that the slower pace actually becomes a little bit more difficult because you know that you can fix it, and so you become more motivated to do whatever you need to do to eradicate the problem, because where you land at the end of all of this is in freedom. It's what you're actually seeking in the addiction is what you get out of this program, which is freedom. Freedom from the obsession, freedom from the craving, freedom from the compulsion. So you get far enough into this and you understand that you don't have to live a life either in active addiction or in craving. There are other options, and the other option is absolute freedom from all of it. And so it may take time, and sometimes if there's more than one addiction to more than one thing, which for a lot of us there is, it may take some time. So I would say be patient with yourself. This program requires perseverance. It requires strength. It requires commitment. It requires an ability to, and a willingness to be in some amount of discomfort as your brain heals and as your reprogramming efforts establish themselves cognitively. But what I can tell you is, just like any other injury, it will heal. Your brain will heal. And what you'll find if you refuse to stop trying and if you insist on implementing this skill set is you will no longer have to be a slave to any substance, to any person, to any behavior. You will be free. So, other paradigms that are available. So there is the AA model, the support group model. This is the one that is widely utilized by treatment centers currently. Most treatment centers and 12-step programs utilize abstinence-based models. So this means basically you're expected to adhere to complete abstinence upon your committing to this program. The problem with that is that it creates shame and guilt when the person isn't able to hold it, when they don't have the skills that they need in order to hold and maintain continuous sobriety and they relapse, so to speak. It creates a shame, an unwillingness to go back into the program, to back into the support group. There's this fear of being shunned. It's this whole thing. So that is one of the problems with that paradigm. There are some places that work in more of a harm reduction manner, and what harm reduction is, there's an excellent book on this. It's called Undoing Drugs. But harm reduction basically is more in alignment with what's offered through this program, meaning you're using less harmful behaviors to use as stepping stones as you step your way out of this thing. The only problem with that one, well, one of the problems with that one is that you can sort of get stuck in this middle area of like, okay, well, I'm no longer using IV drugs, but I also, like am drinking alcohol 4 nights a week, which is, so it can be a little bit sticky in those in-between zones. But also a very, very valuable and also a much more attainable model for a lot of people. So that is another approach. I know there are a fair number of different support groups forming Recovery Dharma. There are different sort of names and formations for different 12-step organizations. And I think support groups can be tremendously helpful in terms of maintaining some kind of social network during your efforts to get sober, because what can happen is when you start dropping these behaviors, what you can find is that the rest of your life falls apart before it's rebuilt. So you lose friends that you had, or you no longer enjoy the activities that you used to enjoy when you were using, or maybe you start having difficulties with a partner. Maybe you realize that, all of these things that you had in your life are no longer good fits for you. I mean, these are very stressful things to be going through whilst trying to get sober. So the social networking of various recovery programs can be invaluable. So that is one thing I wish I would have done a little bit better, is sought earlier social support in my efforts instead of isolating, because the isolation, I think, can be detrimental to the progression of this process. So what you can expect. So we kind of went over this, but don't expect an overnight solution to this problem. This is not a model that relies on or encourages even necessarily or expects perfection immediately. This is not an abstinence-based program. This is a program of phasing out unhealthy behaviors through the skill of being able to drop habits, with a phasing in of healthy habits and behaviors using the skill set of being able to adopt and permanently and effectively integrate the positive behaviors. So you look at it as, if we're using the cancer analogy again, we're shrinking the cancer. We're shrinking the cancer while simultaneously treating the symptoms. So we're shrinking the cancer whilst dealing with the symptoms that can cause other problems in the physical body. And so you get a shrinkage of both of these things until eventually you get to a place where you don't feel craving and you don't feel the compulsion to use, and that overlap has developed in a large enough way that you have all of these other things filling the space where that big gaping hole of wounding used to live. And when this happens, you won't want anything, and you will have the ability and power to build a life beyond your wildest dreams. And it's pretty cool. So you can expect your life to get a whole lot better. It may get worse before it gets better because of the reasons that we talked about in terms of really coming back to yourself and learning who you actually are, and having to deal with things like making new friends and maybe breaking up with partners, and disruption in family dynamics, and disruption in your job. And, these are all things that can happen earlier in the process. So anticipate this, and it may not happen for everybody. And if it doesn't happen to you, you are so lucky, but it does for a lot of people. So anticipate that, and also expect to learn how to sit in emotional and physical discomfort as your body and brain adjust to this new way of being. This is not, again, something that happens overnight for a lot of people. So there is a neurochemical and physical and energetic and emotional and spiritual adjustments. These all have to happen. And as you're going from being in this very dysfunctional space to this higher up space that is where you'd like to be, this period in between is uncomfortable, and you will get through it, and it will not kill you, but it is uncomfortable. So anticipate that as you step into utilization of this program. This is a skill, and once it's developed, it will be able to be applied to a multitude of different things. But please understand, until it is developed, it is going to take a lot of practice. So that means that you may have to redo the lecture series over again. You may have to redo the whole thing. You may need to come back to a component of it. There is going to be a book eventually that I haven't gotten around to publishing, but you may have to come back to these things because, it's just like anything else. Until you've proficiently learned how to ski or roll a kayak or ride a mountain bike or whatever else you're learning how to do. Those are the analogies that I can think of. But until you have adequately learned how to proficiently do this as a skill, it's going to require guided practice, which is the reason for the existence of these lectures. Once you have it, and it's yours, and you get to use it in your life to do whatever you need to do for yourself. And that is the gift of seeing it through. But until then, be patient with yourself and expect that, once you are able to apply it to a certain cluster of behaviors, maybe then like this whole other thing crops up that you didn't even know was under there. Like, this is a layer. There's a lot of layers to this. And so once you get through, say, like the layer of substance addiction, maybe there's this whole other layer of addiction that pops forward that has nothing to do with substances, but everything to do with behaviors. So just be aware that all of this is normal. All of it can be dealt with. And the more proficient you get at this skill, the more quickly you will burn through these issues in yourself and really, heal the entirety of these core wounds. I think that's it for the introduction. If there are questions, comments, concerns, you can leave comments and send messages, and we will do our best to get back with you as quickly as possible. Please note that if you are currently on any mental health medications, if you're currently on any antidepressants or any off-brand remedies for treating depression, when you are in the early stages of getting sober, that is probably not the time to discontinue your antidepressants. And I say that from a place of experience. It can create a lot of unnecessary suffering. It can create a lot of unnecessary mental health symptoms. There is absolutely a way to get off of mental health medications, and that will be in a lecture series created later on. However, I highly recommend that you wait until you are at least 3 to 6 months into your recovery and feeling good about that before there is any attempt to mess with any existing mental health medications. Also, on that same note, it may be worthwhile to think about, if you are unable to create any gaps in your usage, it may not be a terrible idea to at least toy with utilization of pharmaceuticals in a very temporary way to help support the brain as it makes that transition. An example of how I did this was, nicotine, like I said, was the last one to go for me. I did utilize Wellbutrin for 30 to 45 days in my first little stretch without it, and it was incredibly helpful. And that's an example of a medication that's pretty easily discontinued and doesn't have a whole lot of withdrawal or anything like that. So there are options for utilizing pharmaceuticals in assisting you in the early stages of this. The same is true for alcohol use disorder, opioid use disorder. There are medications that can help in the very early phases of that. Just remember to use the medications as a tool, not as a crutch. They're an excellent temporary solution, awful long-term solution. So that may be helpful. Another thing that will be discussed in supplementary lecture is the utilization of psychedelics in attaining sobriety and the pros and cons of utilizing plant medicines throughout this journey. So I will look forward to seeing you on the first lecture of this series. I sincerely hope that it is helpful and that it reaches all who need it. Thanks so much for watching.